Today I'll be informing you about spina bifida, the three main types, what causes it, and how it can affect your child. I'll be using this baby doll as my visual representation. According to Centers for Disease Control and Prevention, each year 1,645 kids are affected by spina bifida. This is a birth defect. I am credible to talk about this because I have previously researched and gathered information from credible sources around the world. Each year in the Hispanic community, 3.8 per 10,000 live births are affected by spina bifida. In the African American community, 2.73 per 10,000 live births are affected by this. And lastly, in the Caucasian community, 3.09 per 10,000 live births are affected by this. Spina bifida can also affect your unborn child while it is still in the womb. The first type I will be talking about is spina bifida oculata. This is not physically seen, but can have long-term effects on the child. This is also the mildest form of spina bifida. This can be caused by folate deficiency. Folate is B9. If the mother does not consume enough B9 while she is pregnant, therefore the child cannot consume enough B9 also. This can affect your child in many ways. They will mainly have skin problems around the lower back, and in rare cases can have skin problems around the upper neck. They can also have a latex allergy. This will be a problem in the hospital because doctors and nurses wear latex gloves. Spina bifida oculata is the mildest form of spina bifida, but can have long-term effects on your child. The second thing I'll be talking about is spina bifida meningocele. This is covered by a thin layer of skin, but is visible to the eye. This is not the most serious. There are two main causes of this. If a parent has diabetes or if a parent is obese while consuming the child, this can cause the child to have spina bifida meningocele. This increases the cellulites and the sugars in the child and can have the effect on it. The future problems are just as serious as the next. Just like the spina bifida oculata child, they will have skin problems. This child will also have a sleeping disorder caused by the treatment plan that the parents choose. Spina bifida meningocele is covered by a thin layer of skin, although it has lifetime effects on the child. The last thing I'll be talking about is spina bifida myelomeningocele. This is the most fatal. This is where the membrane and the spinal cord push through an opening in the lower back and cause a sac on the back. This can cause it right here, or in some cases on the top of the back, closer to the neck. The causes of this are something you would have never guessed. If the father or the mother of this child has taken seizure medications, it can cause the child to have spina bifida myelomeningocele. It can also be caused by an increasing body temperature in the mother during the first trimester. This is called hypothermia. The effects on this child can cause the child to pass at a very young age. They are not expected to live very long. The two main effects of this child will be cumulative fluid to the brain and swelling on the brain and other problems. This is the most fatal and it has the worst lifetime expectancy. Any child born with spina bifida will have mobility problems and orthopedic problems as long as they live. In conclusion, there are three main types of spina bifida oculata, meningocele, and myelomeningocele. They have severe effects that will affect the mobility problems and the orthopedic problems of the child. Each year, 1,645 children are affected by spina bifida, and on average, each parent and family has to spend $21,900 to $1,350,700 to pay for the child's hospital bills and medical treatments.